Hi, I'm Dr. DiMichele. I'm originally from the East Coast and have come here from Nampa, Idaho. So we are absolutely in love with Idaho, and I have been a doctor now for over 20 years. That's a very good question, because the ability to get pregnant is way beyond just jumping towards what fertility treatment you need. A thorough examination needs to be done. We have to keep in mind that 30% of the infertility that occurs is women, 30% is men, and the other 30-40% is either both the partners or some unknown reason. So you can't just jump to fertility. A thorough workup needs to be done, both of you and your partner, before we can find out what the cause is and then address that cause. The days after your period that you're the most fertile depend on what your period cycle is. So the average is 28 days, so that's what people think is what your period should be. But each person has their own cycle. So for instance, if your period is 32 days, that is your cycle. As long as it's regular and it's repeatable and you know when your period's going to come, take that as your cycle. The thing with ovulation is it's 14 days from your cycle day backwards. So you don't go forward, you actually go backwards on this one. So I'm going to show you a picture of what it looks like what our body does and the hormones that occur during ovulation and during our cycle. So what you're going to see here is a spike in estrogen and then a spike in the luteinizing hormone. This is a hormone that you're going to be testing when you do your ovulation prediction kits. Ovulation occurs, and then should you not get pregnant, the hormone levels drop and you get a period. But this time from here is very predictable, 14 days to here. This varies depending on your own personal cycle. Prenatal vitamins are essential in pregnancy, and the main reason, especially in the beginning of pregnancy, is for folic acid. So let me go a little bit backwards on that one. You should be taking, if you desire to get pregnant, you should be taking the prenatal vitamins at least a month before pregnancy. We sometimes even say up to 3 months. There's been data to show that a year has even decreased the risk of other disorders like preeclampsia and preterm labor. But that 1 month is essential. You have to increase your folic acid level. And the reason why is that the baby's neurotube defects. So if you look here, you can see the neurotube is a entire spinal cord. It starts from the head, goes all the way down. So this is an example of a spina bifida. If you do not have enough folic acid in your body, you have an increased risk of developing a disorder. This spinal cord and the neurotube defects are completed by 26 to 28 weeks. So that's why it's important to have it on board beforehand, because by 26, 28 weeks, it's completed. It's very important that you take other supplements to ensure a healthy pregnancy. The ones that come to mind the most to me are what I see very common deficiencies of, and those are calcium, iron, vitamin D, vitamin C. Those are all important. The good thing is, if you take a normal prenatal vitamin, it doesn't have to be anything special, you will get most of those vitamins in there. But what you won't get is calcium. Calcium is a large molecule. You will have to take that separately. So during pregnancy, it's recommended that women over 18 get 1,000 milligrams a day. Before 18, 1,300 milligrams a day. And this continues throughout pregnancy and into the postpartum period as well. And the importance of that is that calcium is needed for our bones and our muscular activity to perform normally. If you don't have enough of that, your body will literally feed the baby. So what I'm saying is, baby comes first. God has designed this perfectly, that the baby is the primary person who comes first. So it will literally break down your own bones to give the baby what it needs. The food and nutrition that you need during pregnancy is very interesting. And I actually put an article together for that, because what I find very common questions is what about fish? I love to eat fish. One thing that I have seen in various parts of locations is that if you're going to fish yourself, please look to see what the mercury content is in that area. Mercury is the problem with fish. Some fish have much higher levels than others, and I have put that together in this article, showing you the different types of fish and which ones are going to cause you problems. It tells you how much to take and what not to take. That is important because the DHA that you're going to receive from this is essential to the baby's development as well. Other foods that are going to cause problems in pregnancy tend to be unpasteurized milk, which is not that common in this country. And people worry about, well, what can I go to Subway and get a sandwich? Honestly, the answer is no. Unless that meat has been heated to above 165 degrees, it can contain a bacteria called Listeria that is both dangerous to you and the baby. There are drinks that you shouldn't have. Of course, avoid alcohol. There's no minimum level of alcohol that you can take in pregnancy. There used to be drink 1 glass a day, used to be the old saying on that one. We know now there is no level. We don't know if that 1 glass will cause fetal alcohol syndrome, so just avoid it altogether. There are certain drinks, so you will see drink an herbal tea. Well, unfortunately, herbal tea can actually deplete your folic acid level and cause some problems. So please read up on this before you go and consume something you're not sure is safe or not. No, there's just no safe limit. This is coming from the American College of OBGYN. So they build the guidelines that we follow because they have tested all this information. And the guidelines states, no, there's no safety limit. I'm going to discuss some of the more common ones. So when you first get pregnant, you will notice changes that are obvious. Like, for instance, you'll notice an expanding your belly. You might notice some cramping in the uterus as the blood supply increases to the uterus. You will notice breast changes. You'll notice a darkening of the areola, which is the area around the nipple, and breast tenderness, enlarging of the vessels in that area. Nausea and vomiting are very common. This is about 70% of all women, and it's not just morning. It could be all day and all night. Usually occurs at 6 weeks, peaks at 9 weeks, and it's usually done between 12 and 13 weeks. Although unfortunately there are women out there, this continues the entire time. As we progress, of course, you'll notice that your belly will enlarge, and with that you'll have a lower back strain because of the curve of your back trying to compensate for the weight in front of your belly. This will cause back pain in about 70% of women. Our body releases a number of hormones, one of which is called relaxin, that causes the ligaments in our body to literally relax. So you are more prone to straining and spraining things. You're more prone to having hip issues because literally that hormones are meant to open up our hips so that the baby can pass easily through. Swelling is very common, especially in the summertime, especially if you're sedentary. We do have compression stockings that have that. Unfortunately, hemorrhoids are very common. A lot of this is due to the baby's pressure on our major vessels, the aorta and the vena cava. And because that baby's pushing on those vessels, it's not allowing a lot of the fluid in the lower extremity to get back up. And so it's causing engorgement of those vessels, also leading to varicose veins. So those are kind of the more common ones. But there is a whole slew of them that can occur. So if you have any questions, please come to one of the 3 of us and ask us, because most likely a lot of this is just your pregnancy. That's a very good question, because there used to be a belief that do little, you're pregnant, don't do too much. The answer of it is actually the opposite. We want you to be active in pregnancy. We have shown that if you are active in pregnancy, you have a decrease in C-sections, a decrease in gestational hypertension, gestational diabetes. You will have an increase in your vaginal deliveries and actually quicker, easier vaginal delivery because your body is toned. But don't just jump into an exercise regimen. If you're already in one, continue that one and elevate it slowly through pregnancy. Once you're at a moderate intense, there is no heart rate determination anymore. That's again a past belief. So we want you to look for symptoms such as my belly hurts, or I'm bleeding, or I'm having repetitive contractions. And of course, if your water breaks, anything that is concerning. And I again have this in a paper form for you to review so that you can see what is concerning, what can I do, and what are the parameters for which I should be doing exercise. These are to continue after postpartum. So if you have a C-section, obviously you're going to avoid the abdominal muscles, but if you're vaginal delivery, you are just welcome day 1, day 2 to start going out there and exercising at any pace you would like.